Kalispell is about population of about 20,000 people. And when you start looking at places like Whitefish, and you go down to Big Fork, and then you go out west to Libby, it's beautiful. We have lakes, we have rivers, we have all the outdoor activities that you could ever want.
Kalispell is fairly small and rural, and I would say that the range of psychiatric disorders here is as great as it gets.
The NHSC provides a very valuable service in primary care, also in psychiatry, and helping to bring people to communities that may not have access to the mental health care needs that they have.
Good afternoon, the Newman Center. This is Beth.
The Newman Center is so great because we have psychiatry, we have therapy, we have a psychologist, and we have a nurse practitioner. And that's pretty amazing in a small community.
Hey, good to see you. I work specifically in child psychiatry, so I work a lot with families and helping those families grow together. There's definitely a need, and a very strong need, for psychiatrists in rural communities, and in particular child and adolescent psychiatrists, which are a shortage everywhere. Did you do anything fun so far this summer?
I got my pool up.
I think you get an invaluable experience working to help people or to help them solve their problems. In an area that's underserved, you have a lot of people who might not have access to you and are very happy to see you, so it can be very rewarding.
I think mental health and primary care integration is vital.
Okay, I'll let her know that you're here.
All right, thank you. There is such a connection between how we think and how we feel physically.
The connection between psychiatry and other very prominent medical problems like obesity, for example, is a strong connection.
Okay, come on back.
We're working primarily in northwest Montana, in the surrounding communities. I would say within 200 to 400 miles radius, and that's how far we're doing outreach stuff. People are traveling from 2, 3, 4, 5, 6 hours. That's one way. You have to anticipate that on the way back. People don't have one day. They're working 9 to 5s.
How are things going for you?
We also participate in telehealth, which is essentially mental health via Skype and with a secure connection. When you look at some of these rural healthcare clinics, there's not a psychiatrist within 400 or 500 mile radius. So what telehealth does is that gives us the opportunity to have patients be able to see all of the experts that they need.
Any depression? Any big stressors going on? Or
Telehealth that helps serve those who cannot receive care elsewhere. There's a huge stigma associated with mental health, and so people tend to turn towards alternative means of coping. One of the bigger ones is alcohol around here.
The medical use of opioids is highly problematic. You know, I talk to patients about how these substances affect the brain and the body.
It's not just the individuals that are being affected, it's the family members, it's the hospital system, it's everyone in the community. But it's extremely challenging.
Sometimes it helps to take a step back and, maybe discuss a case with someone else in the group, someone who may not have that emotional connection with that patient.
Every member of the multidisciplinary treatment team has a specific form of input and what they draw from in terms of their education, their training, and their experience.
Integrated care is something that is extremely important. When you get more eyes on a situation, you can start to collaborate and really try and figure out, well, how is it that we can manage diabetes and schizophrenia at the same time?
The more that you can collaborate with other individuals who are working together in a team is definitely to your benefit, to the benefit of the patient.
By using NHSC providers and NURSE Corps providers, they're able to come here and be in a setting and really practice the direct care that they want to practice. And it creates an environment that they can do the care that they want to do.